Bring us all down. You've been having some, low back pain going on in your legs. Tell us everything about that.
Yeah, like I say, I have on a right back over here, right back on the hip, it goes down all the way to the leg. Especially when I wake up in the morning, tremendous pain. It takes me some time to adjust getting out of the bed. I mean, during the day, from 1 to 10, after 2 o'clock, from the pain is from 1 to 10, I'll name it as a 9. During, after 2 p.m., 3 p.m. when it warms up, I'll say it goes back to 6. But the pain is there. When I wake up in the morning, it kills me. They even let exercise and try to do some exercise to get back on my feet and get the day going. It takes me some time, so I have to start the day with Advils.
Understood.
I take the Advils. It releases the pain a little bit, but I still after a couple hours, it goes back the same.
All right, Chad, let's take a look.
I had the exam for like 7 years. In 2012, that's when I felt it. In 2012, and I said, "What is it? Friends suggested, go to physical therapy." I went to physical therapy, and I was going for quite a while. You go away for a little bit. I did acupuncture. I did all that. I tried everything. We'll go away for a little bit. We'll relax me a little bit on like summertime, and I spent a lot of money on acupunctures and left and right. I don't want to mention them. I never got fixed. I still had it. I'll play my sport. I'm a guy that plays soccer and stuff. Now I'm after soccer, and still had playing with pain. 2 years ago, it kind of disappeared for close to a year, for 9 months, and then boom, it hit me back again. And beginning of the year, I would say February. From February, it's been high pain from February of this year, of 2019. It's been there, and I tried. I will go even last week. I went to therapy, 2-3 days a week, did acupuncture and that. I don't think so. It works. It doesn't do nothing on me because it's still there. So.
Understood.
So I heard a lot of things about here. So let's see. You have a good reputation. So let's see.
There you go. All right. So let's look for that abnormal temperature. And we got one all the way down here. You pointed, we already feel that pain. You said, there you
as
go.
As soon as you did this right now, boom.
You feel the pain going down your legs?
Yes.
All right. See, there's a little puppy in here, all in the secret of that joint, this right side. Yep, that's not moving. Yeah, see, your left side's moving just fine. See, this is your right hip, right ilium. That's a brick wall. It's not moving whatsoever. Sacred's moving just fine. See, these are moving just fine. It's that right ilium over here. All right, champ, go ahead, march in place. Not too fast. Go ahead, march. This is what I'm trying to look for. I'm trying to look for, these things are symmetrical. It should move downwards. But this one, it's just jammed. It's just not moving whatsoever. Whereas the left one is moving just fine. Sacrum, the excursion moves just fine. Same thing over here. Sacrum also pivots just fine on this side. But this right ilium, it's just not moving whatsoever. And go a little lower. See, it's also excursion, deviating towards the lateral side. This is just simply going underneath, which is normal. Abnormal is going diagonal, so we have a PIX on this one. Okay, so we tested and confirmed on you. It's this right ilium that's jammed up. Now, how we're going to correct it is going to be interesting as well, because we also have some other compound issues going on. I do see an old left groin injury, because see on this one over here on the right side, that's normal. Left side, right? You must have had one wicked groin muscle pull bad enough that the muscle was trying to rip right off the bone itself. That's why this is enlarged over here. Other thing that just compounds and makes this one a little more challenging to correct is we also have a degenerative joint disease over here and here as well. So the fifth and the fourth, see these over here?
Yeah, the space in between.
Right. The space between these bones, these are more normal size. See how much smaller it got on your fifth and your fourth lumbar. Right? So in effect, what happened was it starts steadily pinching those nerves, and these nerves innervate to that right hip. Other things, and that's what we're going to try out. Because of the way your spine is misaligned, this one over here is right now rotated towards this way, and these bones over here, they're rotating opposite direction this way. So it's not so straightforward in terms of for most of the Gonstead students and the younger dogs. Traditionally, we correct this by doing what we call a PIX pull maneuver. But this one is going to be a little more challenging because if we do that, then it'll cause these bones that are significantly towards this way, right? It's going to start rotating this way, but this one over here, it's going to start making this one a little bit worse. So that's going to be a little interesting challenge in itself. So we're going to start off with a pull maneuver first and see how that responds. And if not, push maneuver may be our better bet.
Okay.
Yeah.
All right.
Yep.
Yeah, this one, like you say, the left groin, I hit it like 2 years ago, and I pulled it right on the game.
Oh, actually, no, slow down. Let's put that in a video. Okay. So, go ahead.
This left groin injury,
Mhm.
this left side that you say, yeah, I thought you looked on the right side, but yeah, the left.
No, that is on the left side.
Yeah, it is.
Yeah.
The left side, 2 years ago, I was playing on a game. It was indoor, was winter, was inside. And as soon as I were running and I felt that pull, and I stopped off the game, I came off the game. The next, after 2 days, I couldn't walk. The next week, I didn't even go to therapy because I said, you know what, let me give it time. I was bruised from here all the way down here. So now that you're telling me, yeah, that was a benefit. I stayed out with like 6 months. I went back to play after 6 months, and I wasn't 100%. Should give it more time.
All right. No, go. Just gotta relax. Oh. There it is. Let that thought clunk in. Okay, free hand. All right, so, close in. How's it?
Well, I don't feel this pain in the head in here before, and as soon as you put me there, one thing I do, because I used to feel this thing, I used to feel it over here too. Sometimes I used to feel over here in my back.
Let's show it to the viewers.
So,
turn around. What do you usually used to feel?
the same thing, going down the hip and going down below the leg. The same thing, that muscle. A lot of times I'll feel it over here. I'll feel it here in my back. Right over here in my back, I'll feel it. Not as much as over here, but right over here. And where do I feel it? By the standing over here and looking down to my legs. When I put my head down, looking down to my fingers, my toes, I'll feel it. But now I do this, and I don't feel anything in here, which is pretty surprising to me because I had this for a long time. And
so, say that once again. So basically, you don't feel anything when you look down?
basically, I don't feel anything. I feel the same as on my left side now. So when I'm here, when you put me down, the first thing you got me out of that chair, you put me down. I did this, and by doing this, looking at my toes, I always had this. I can feel the muscle going down by doing, because that muscle runs all the way up here. You can tell, and by doing this, stretching the muscle, I will feel it. I mean, I don't feel it here now. I don't feel it here where I used to feel it. From the leg and down, I would say I'll feel it from 1 to 10. I'll feel it like 4, the pain. It used to be 7 and 8.
So we cut it down to half.
So you cut it down to half.
That's good progress right there.
Over here, I don't feel it anymore though. So,
That's excellent. So here's the thing, because this is chronic edema over here. On top of that, your 5th and your 4th lumbars, right? Those are still a work in progress. We need to correct that on a future follow-up visit.
oh, okay.
So
Alright.
what you do is ice this over here 20 minutes, 3 times a day. We'll do another follow-up. I want to see how this thing's healing.
Okay, all right.
Okay.
So that's it for now. All right.
You got it.
I appreciate it. Well, it looks good. So for now, it looks good.
How are things since I last saw you?
Well, like I said, after I left from here that day, for the, I felt really good after I left from here. The same night, following that night and the following day, after 2 days after I left, I felt in pain.
Mm-hmm.
So then after that, the back pain, the lower back pain, it started disappearing. That started went away, and for the past, I would say, week, 10 days, I've been feeling really, really good. The only thing, like I said, that pain goes down to the leg, is still there.
All right.
But the lower back pain, after those 2 days that I left from here, after those 2 days I was in pain, since that it disappeared, better mornings,
Good.
better days going, definitely much, much happier than what I was.
Excellent.
The lower back pain, so I haven't felt the lower back pain since I left from here at all. The only thing, the rest we got to work on, like you say, the pain went down the
We're
leg.
going to work on it. I believe on the last visit we mentioned about that fourth lumbar. I want to keep an eye on it. So we're going to double check on you right now. Let's see how that fourth lumbar and the fifth lumbar are doing right now.
Oh, okay.
That's right.
I got you. Thank you.
You're very welcome. I did mention that it may aggravate. So
Oh, you mean the...
with the sciatica, that's what you're feeling.
Oh, okay.
That pain going down your leg?
Yes.
Okay. Yeah, as we mentioned in the previous visit, that fourth lumbar, that may be the one that we may need to address today. So we're going to take a look, see what's going on today.
I got you.
All right, do me a favor, sit up straight for me, please.
Yep.
Thank you. So we do have nerve pressure right here. Yeah, just that one.
Nerve pressure said that, yeah, if I meant to mention, I feel it over here. A lot of times I feel the pain over here too, like the, most like a nerve I'm worried, but I feel it right here.
Got it. Yeah, you do have a chronic edema right here. Let's check this out. How's that feel right there? That's your fourth lumbar. Right?
I feel it right there.
Yeah. Yeah, everything else is just fine.
Yeah.
See, how's this one right here?
That feels okay.
This one right here?
That one right there.
That's your fourth lumbar.
That's
Okay.
the one that you hit.
Yeah, that's what we're gonna address. It's time.
I got you.
Okay. Oh, this is a fun one to correct. It's a really interesting one to correct. Oh, gracious. Okay, where's the hands in there? Yeah, that's why we have this little challenge we got going on, because everything's rotating this way, that way, this way, that way. But the way things are motioning, things seem to settle down a little more, so get away with. We could do that. That's fine. Let's make it happen.
Okay. I'll take my shoes off.
Nope, you can leave them on.
Okay, that's fine.
Okay, lean your side for me, please.
On the side this way?
Mm-hmm. Got it. Come to the edge.
Okay.
A little more.
Yeah.
Over here. Gently. So the reason why we're doing the push maneuver on this visit, because the ilium, the way we corrected it, it took a lot of that torque and tension out of it. So now we're gonna do a push maneuver on this one, so we don't have to worry too much about all this counter rotations and so on and so forth. So, this glasses over here. Okay, here we go. Just let this go. No more. No. Okay, come on. Okay. Walk around.
feel much. The reason I'm doing this, I'm looking at down, because every time I get my head down, and I'm looking at my toes, like I said.
I remember you mentioned it.
Yes.
You always aggravates that. So how's it now?
I feel pretty good in life. I feel pretty good in life. You mind if I sit down and get
Sure,
up?
go for
Because
it.
that's when I sit down and get up.
Sure, absolutely.
Let me see. Okay. When I feel up, right, when I get up right away, a lot of times that's why I keep going right away, then I feel it. So that's why I got up and I went right away and I didn't really feel anything. So,
Doesn't trigger anything, huh?
really interesting.
It's not interesting. It's biomechanics, brother.
No, really interesting to me because it's been for a long time, It's been, and it's been like you said, aggravating for a long time, especially.
Well, we also see that here. It's all that degeneration you got over here. This fourth and the fifth over here. But as I explained before, I believe that this thing worn out because of that right ilium that was just jammed up. But that fourth, no, that's because that fourth lumbar itself. That's when I was in trouble that we had to correct today. Pinching up that nerve causing that sciatica going on your right leg. All we did was just maneuver, realign the back proper position, took that pressure off that nerve. That's why it feels a lot different now.
Is it gonna hold?
No, you tell me. Well, I can't see the future, but considering how badly that structure is damaged over there, right?
I saw that the last.
Right, yeah.
Last time that were-
This is not going to be a one visit type of correction, and your body needs some time to regenerate, to heal and repair that structure over there. It is going to take some time, so we're going to find out what that magic number is for you. You may need a correction either once a week or once every 2 weeks. We're going to see how you heal up during this course of time.
All right, Doc, definitely.
But the fact of the matter that you already experienced already a lot of relief there, and that's good progress and a good sign right there.
So no, with this, I don't know what you did over there, the way you cracked me, the corrected, thing, but I definitely, when I sit down, like I said, and I get up, and I try to go right way, I feel it. That's why it's been in my head now. When I get up from the seat, I gotta take it slowly. But when I get up, sometimes I forget and I go, I feel it, and the numbness and the pain, like a knife, going down the leg. And the most important thing that I always do when I look down, I can feel it. Here and going down, I can feel a little bit, but here and going down to the knee, I don't feel it.
That's good.
I don't feel it from here to the knee. Usually I feel it from here all the way down to my ankle. Now I can feel it here, but...
Good. Now here's the thing. Okay. Bear in mind, like I said, it's chronic, it's old, it's been there for a very long time.
Yes.
Quite a bit of structural damage to that. I want you to ice this over here for the next week.
Ice it.
Right, 20 minutes, 3 times a day. Let's get some of that chronic swelling out of the way. Let your body repair some more.
Okay, all right.
And we'll see you in the next visit.
Yeah, definitely. I'm looking forward, and hopefully this is gonna hold. Hopefully it's gonna hold because it's been, like I said, it's been.
I hear you.
It's been, but looks good.
We'll see you in the next time.
Looks good.
All right.
Thank you.
You're welcome.
Thank you.